very grateful to the Omni Inquiries and the team of Shoaib and Prashant. Today I will be getting back to you with a new topic, which I thought I will put a heading as a biosafety, but the people have suggested me biosecurity. I found it is very interesting to talk about biosecurity for the hospitals and clinics. So today's topic, as I already introduced, it is a biosecurity for the hospitals and clinic. As such, there is no much concept about this one, but COVID-19 has opened a Pandora box of why the environment, everything we live must be safe. This is also, you see, now much of the resources are spent on spraying the thing. But the definition of a biosecurity is a strategic integrated approach to analyze and managing relevant risks to human, animal, and plant life associated with the risks for the environment, which I already mentioned. We are all just a part of the environment. Now the microbiology is also moving from a narrow part of a medical or anything to a environmental. Unless everything is good, we cannot be safe. That is the criteria. And what the Wikipedia, above all the things I found, it is something interesting definition. Biosecurity refers to the measures aimed at preventing the introduction and or of spread of harmful organisms, virus, bacteria, parasitic to humans, animals, and plants in order to minimize the risk of transmission to infectious diseases. So we are part of the nature, but much of the plant has not much some toxins in some forms. So the term includes biological threats to people, including those from the pandemic disease and bioterrorism. So a lot of discussions about the COVID is there. It is a pandemic, but whether it is a part of the bioterrorism contains a lot of politics, science, and opinions. So I will not go into that one because we do not know really how it has happened. So safety definitions, the definition has a lot of variation. Definition has sometimes been broadened to embrace other concepts, and it is used for different purposes in different contexts. So if you ask me, if you ask a postgraduate student, what is a biosecurity means, he thinks it is connected with a law or some governance, but he will say much about a biosafety rather than the biosecurity. So for us at this stage, we all mingle these two words and talk about it. So if you ask me in simple terms, suppose if I'm teaching to an MSc graduate or BSc graduate, see, simple terms, biosecurity means, see, you see, the people are wearing a mask. It is not, it is just a biosecurity because there is also a law. You can punish some people who are not wearing a mask, or you can create a social distancing. That is also biosecurity. That means these two slides will enlighten not to make the matters very simple. What is a biosecurity means? It has got some law. Somebody cannot be going without a mask. And next is, if you ask me a very simple word, biosafety. Here there is no supervision and totally you are responsible to prevent the spread of infections. This is a simple definition I can give it. How is the India dealing with this issue? The various aspects of biosecurity in India are managed by ICMR, CSIR, and DRDO, Defense Research. Considered as a health and agriculture matter in India, hence it is largely dealt with the states. So you know that there are a lot of controversies between the state and center that we are not competent to discuss in this form. Because the health is mainly a state subject, they can make their own decisions. So there the biosafety law, biosecurity laws are being stuck and nobody is clear about it. Suppose somebody, you go to Karnataka and ask something about a biosecurity, they will ask in a different, answer in a different way. But the biosecurity bill drafted in India has been pending approval since 2014. Also, it does not take zoonosis like coronavirus into account, but they are not modifying. If you go into the literature, on April 21st, China has come out with their own biosecurity laws because the world is blaming them. They are also partly responsible for this thing that we do not want, that we will So it is a biosecurity. Still, India has this form also has created a good awareness to so many people that you cannot be alone, practice some in the department or a laboratory, but we have to have a wider. Next is draft on biosecurity. This is an international draft. They made it and they want to implement. Bradford Disarmament Research. They have started in 2014. There is a manual. It is concerned more with Europe and the Europe. So, suppose coming back to this one, it is not today we are talking about biosafety or biosecurity. It's a very old. If you see the Nightingale, she said the very first requirement in a hospital is that you should do the sick no harm. Already the person is coming to a hospital with challenges and you infect a person with all your carelessness, then life is a really dangerous thing. And once again, definitions and all these things, they are including so many principles now. Everyone, because ultimately we have to come, because the organizations are CSIR and all, and also they are including hazardous biological materials. Suppose if you are doing an antiseptic, you are using, and it may be hazardous also, that also should be included. There is no quality control. Everybody is doing some hand washing and bring into the market. They want to bring that is the great challenge and all these things, because our market has gone in many directions without any much control and regulations. Next is biosafety to prevent workers' exposure to. This is the one of the greatest symbols. See, if you follow with the 1986, that after AIDS, the most important thing has come is the universal precautions. People are afraid to touch the HIV patients. Even the people are sterile scope they have seen. Patients with HIV, and there were also incidents when in one hospital, in a very famous hospital, they burned a table, a stool where a patient is sitting, HIV patient. That was the knowledge. So these universal precautions have made many things changes this thing. You accept the patients, but you have to take care of yourself. See, there is a one pendular changes is there. Previously, we are just like doctors are like gods and all these things, that whatever we do, we are society is accepting. But there is a change. See, our life is also as important as a person who is a patient. So don't worry about it. You follow certain precautions, you are safe. Next is, see, it is just not that today we have got a very good beginning, this one. There can be great scholars and all, they can talk about. It's not a simple, just biosafety is not one word or some hand washing. So we have to, it included, and sometimes they can invite some good lectures for this one. Infection control, nosocomial infections, universal health precautions, waste management, vaccinations, and implementation. This is the most important topic, which is hunting the society about vaccinations and also the implementations. Now it has to be included in the biosafety concerns, because every state cannot make their own this one, because the government of India want to make this vaccine policies to be uniform to all the states. They can do whatever they like about their PHCs and all general hospitals, but to the vaccination, they have to listen to this one. Includes and also handle animals, plants, cell cultures, everything is not much. The goal of biosafety is to reduce, eliminate the exposure of the lab personnel and the community and the environment to potentially infectious and hazardous agents. And this is achieved by principles of containment and risk assessment. I want to tell quote one thing is there, we are great friends. Dr. Chuk was a very famous, he recently passed away, he is above 80. He was telling, unless you create confidence in the employees who are working in a laboratory or a hospital, a day may come. Suppose if they listen that the technicians working in a particular laboratory died, that means the people will run away from the hospital. Now we are finding the acute shortage of the microbiology technicians and all. They prefer to go to biochemistry than to microbiology, this one. So a day may come, if you are not going to increase the confidence in these people, the labs may not function and the competent people may not come. It go into a very vague. How we approach it is based on the recognition that hazards have the potential to be deliberately, accidentally misused, resulting in harm. Laboratory biosecurity is a set system in the research facilities to protect microbial agents. It is very good of the National Medical Commission. I was in the teaching for about 30 years. There was now no law for a MCA to take care of the microbiology department. They were only looking into the professors' faces and also the number of investigations. Now they put it at least we should have a biosafety cabinet for dealing with the tuberculosis and this one. Otherwise, the people working in this one will be put to this one. And also, please remember, most of the laboratories are run by the women. Potentials are very high in the laboratory medicine. So there are so many issues. Somebody may be in a pigment and they can carry the infection. So the topmost priority to the government India to be the laboratory system, where everything concentration of the microbes happen and everything has to be processed and also disposed. That is practicing biosecurity. Developing. So if you, I am just see, I am biosecurity is a matter involved so much of investment, so much of cooperation, so much of this one. Unless we strengthen the biosafety hospital, we will not be eligible to enter into the biosecurity cordon. Very few studies from developing countries associated hospital-associated infections. So if you take, you count the people, 100 people admitted in a ICU, 6 to 23 days if they are staying, many people get this one. And you see the most important cause of death can be ventilator-associated pneumonia. You see the COVID has produced a havoc. Suppose certainly these people not only must have died with the COVID, but also ventilator-associated pneumonia, whether it is a gram-negative bacteria or WHO sources, and that means, and also I just want to tell you, there are a lot of legal implications. Sometime back, some people have approached the Supreme Court that the people are being put into the ICUs without any proper indications. They are also quite helpless. What Supreme Court can, it has referred the matter to the Ministry of Health and the National Medical Council, because nobody can just take away the right of the doctor to put where the patient and all. So it means, suppose why somebody is refusing to go to ICU, that means it is not safe. There are so many facts that we cannot take many truths in April. Impact. If you take to the hospital, the available evidence, the impact of prolonged hospital stay is the one thing, causes disability, increased resistance of the microorganisms, and they are all this thing. And also, if you take the cost of the death, if suppose somebody is admitted in the hospital and dies after 15 days or 20 days, the most of the money has been for the occupancy in the ICU and the antibiotics, the money is going on there. And where we go with this one. So this is a very big challenge where there is a lot of changes should happen in the prescriptions of the antibiotics or a policy to change this one. So I just in one sentence, people are dying poor, not only just with the disease, but they're at the end, they are left with nothing. All the money is spent on the antibiotics or the occupancy. So what are nosocomial infections? This is the most important thing somebody must, this is a very important. Hospital is never a safe place. Suppose somebody says hospital does not give life, not only life, but also it gives suffering and death also. So the hospital is there. Whenever they start a hospital, the density of the bacteria or anything entering, it is the easy place for them to come. Why is that one? The people staying there are with the immunosuppressed or some, suppose you take a renal transplantation. See, after this COVID, there are a lot of transplantation programs suffered because the people are worried. Because what will happen, even stem cell transplantations all the world, if you see a hospital, you create a green hospital, the microbes, they find it, they are the most vulnerable people in the hospital, their entire science of saving starts here. Some well-known nosocomial include ventilator-associated, that is the topmost cause of blood death, not only in India, but US also. Methicillin-resistant staphylococci, Candida albicans, Acinetobacter. Today you see, Candida auris, there was a report today in the Times of India, there is a Candida auris is coming in that hospital and there are no drugs are sensitive to that one. People are miserably dying that one. And it is no more a game of cure or anything, but it is a very challenging this one. These are all things, all medical professions are this thing. Methicillin resistant Staphylococcus aureus. Now, if you take to this one after the generation of the third generation cephalosporins, the most misused drug in the medicine is the third generation of cephalosporins that is causing the gram-negative bacteria, and also the Acinetobacter baumannii has become a most important. Luckily, Clostridium difficile is very less. And today also there is a legislation from the government or a suggestion. All the people who are recovered from COVID must also be tested for tuberculosis. It is also coming because of the immunosuppression or anything. So now it is going to have a double effect. Just he does not die with the or recover with the COVID, but also catch a tuberculosis. I don't want to give very complex loss and difference. Suppose if you see a lady getting in the for a normal delivery, the most important procedure they will is a catheterize the urinary bladder because the patient cannot get up from this. Most important cause is 50 to 20% of the admitted people urinary tract infection. These are also a lot of things, and people are not well educated to do the things. They are choosing a wrong catheter and they are not following the things properly. And next comes the hospital-acquired pneumonia. In Kerala, there were some people are studying with the different nurses. If this a nurse does the catheterizations per 100, what are the rate of infection? Suppose another group contains 100 nurses. So then you can suppose a particular nurse is catheterizing and getting a lot of infections. She needs a counseling, she needs a training and all these things. This is, please remember, most important thing is there a person may go for a delivery within 3 days and they will be just thinking they will go, but they catch up with the inheritance. This is all a tragedy when the hospital acquired this one. And while hospitals maintain strict protocols for minimizing the infections, and hard to clean places are there. See, hospital is a very, very wide area. You don't know what the visitors are doing, what is happening with the outpatients. So there are also some hospitals that stick to this one. There's no way connected with the outpatients like transplantation, stem cells and all Western countries. There are hard to clean places are where bacteria, virus, fungi can grow. That we will go. And see, the most education, minimal education one should have is the blood, semen, vaginal secretion, CSF, synovial fluid. These are all the high, this one. Suppose, see, you take December 1st has been celebrated, not celebrated, done as a World AIDS Day. You find the red ribbon. That means wherever you see red color, that is blood. Think about AIDS and be away from this one. These are all specimens carry a high amount of HIV, HBC, HBS. And dribbling some saliva, it is not much infective at all. You need not worry about it. More worried about decontaminating from the feces. Feces may be unhygienic material to look, but it is not highly infective. Nasal secretions, sputums, unless they're all blood stained, this one. So many times we are caring for the things which are less infective and we are caring more for the things which are hygiene. This is what is the most important in India. See, biosecurity, we may pass 100 laws, but it will not work at all because it may be on the paper and the officials who are making it to terms and circulate. You see, if you are working in an organization, every month we will receive about 20-30 circulars from the medical superintendent about this one. So India's future of the biosecurity depends upon the hygiene with the hand washing that is there and all. Even after 200 people do not, there are very seniors, they are very reluctant to wash because of their popularity and their positions. Hand hygiene performing antiseptics. There are also alcohol based. What you do, it is there. See, this is the Similarly's greatest contribution. Even after 200 years, people are careless. Suppose if you ask me, you give a multiple question, what is the most important tool in improving reducing the infections and increasing the biosecurity? I still say hand washing is the only thing you can save somebody immediately by not. Common hand washing with the plain soap and water, or washing hands with the water and soap, other detergent containing antiseptic. This is a very big business. So many companies market antiseptic soaps and all these things. See, if you are not infected with very hygienic, unhygienic material, try to use only simple soap. What happens if you are using chemical soaps? Your hand will get more colonized with the resistant bacteria, and also you may develop certain things. So yet there is nothing like soap, water, and common sense. What the hostler said, still the best thing in improving this. Next is practicing hand hygiene is simple yet effective way to prevent infections. Cleaning your hands can prevent the spread of germs, including, and also there is nothing like hand washing. India, everywhere this has to be the this thing, particularly for the cooks who are working in the hostels. Many outbreaks because the people go for a natural call and they don't wash their hands. This is one of the causes of the spreading typhoid. Suppose if there is any very endemic area where the people are taking in a hostel and getting this thing, we have to improve this one. So there are so many methods how you do it, and do it for somebody purpose, or you are doing really scientific way. We have to follow at least some few steps to do it. It is just a simple procedure, but convincing is very difficult the people. So a simple, consistent, effective this thing is there. Hand washing, and the science starts with the gloving a hand. Suppose you wear tight and it may tear, and you wear a mask that go. See, after 2 years, people are very reluctant, and this one, you wear a gown, and these are all the parts of the biosecurity. These are all actually in US and all, these are all the right of the people to get it, because this involves the cost, like a glove, it is more expensive. And you, what all the, you to see that linen room and all, they're all under improve. Suppose they grade the hospitals in many developing countries, how much biosecure. Suppose somebody want to go for a very critical surgery, oh, these standards are very good. We don't have anything and we only trust the individuals and the name and we go. But these are all these things. And crossing infection, because of the, this is the one of the important. Sometimes you see there were some wrong focusings of this thing. A COVID patient is sleeping with another two patients are having this thing because of accommodation, this thing and all. See, and you cannot totally eliminate it. Cross infection is one of these things. It needs a public health education and all these things. Anybody getting infected a little away from this one, and you can just think. Environment needs great attention. See, in all recently, you have seen everywhere they are fogging the areas with chlorine, so many new types of this one, some tunnels and all these things. In all healthcare, administrative staffing and scheduling activities and proper cleaning, disinfection of the surface. See, if this, if a patient has put some soil with this one, just spraying something will not happen, because there is a lot of organic matter which is settled here. You find a lot of black, this one is there. There you have to be very careful unless you clean it. That's why mopping and cleaning becomes the primary, and next is the only antiseptics. Next is cleaning. Is how during suspected proven outbreak, where environmentals are suspected, routine cleaning process. See, you go to any hospital in Kerala or any modern place, always somebody is cleaning the floor with the mops. And it is also a science by itself. The mop itself is not properly cleaned, and if we are using the same mop everywhere, that will be more dangerous than not at all doing also. And healthcare and the hygiene area, so the concern is there. Microbes tend to proliferate on the floor surface, hard to clean. See, there are so many visitors are coming here and all these things. See, they are walking with only chappals on the road. This is always I tell the people. So you are taught about hand washing. Suppose a technical person is coming to operation theater after walking on the rain or whatever it is there. He won't wash the legs. Actually, Western countries is different. They wear the shoes, but in India, the chappals and all these things they wear, and they bring lot of bacteria to the very safe areas. This one. See, you see a lot of cow dung on the roads. That cow dung contains a lot of spores like tetany or whatever the bacteria and all. They can come very easily into this one. And we are spending much of the money in the Western countries. The money spent on the floor is very little. because they have got been this thing and all. They are, see, in every hospital you find the most of the energy is spent on cleaning the floor, because there is something wrong. People will, this is a one habit, we cannot change it and we cannot impose shoes because it's highly sweating and all these things. And usually they change the chappals, it is also, and also see, if you take to the death rates and all, but in India, hospital, 18% patients who died because of the hospital associated infection. In one hospital where I was working, in a month out of the 30 days, 20 patients are admitted in the ICU, 18 have died. That means how much mortality. That means if the sister tells to all the people, sir, this ICU is very dangerous, either you close it or you run it with the proper this and all. This is also the reason which one has to be. And coming back, there is nothing like universal precautions to improve the hygiene and the standards and all these things. And standard precautions, I think there are no, this thing, we are bombarded with the knowledge in 1917. See, you see no area of discrimination. And you see, if you ask some staff in a government hospital or a private hospital, sir, where we can eat, there is no room for us to eat. And the people will be eating there by the side of the operation theater or a laboratory. And these are all, we should have an engineering control. There are some good corporate hospitals have this thing. Still, we have to improve old hospitals to be modified. You find a lot of things in this one. There's a pictorial. It is necessary to wash hands. Necessary when to in prolonged contact with a patient before taking care of patient, ICUs, and also touching wounds when microbial contamination of the hands likely to occur when contact with the mucous membrane and body fluids. Blood and serum fluids, these are all the highly toxic and material. I will just compound. We made a progress, not adequate. All the healthcare facilities and experts have made significant progress, preventing some types of infection. There is still we have made a lot of progress. There is no doubt about it. If you take to the qualified in 1992, there is no evidence for us at all about this hospital. I used to work in a general hospital at that time. That means just patients are very few, and the teachers were very responsible, and they used to sit there with the patient, a serious patient, and guide. Now it is almost a virtual teaching. The students are becoming, this is one of the things. And also we have, no, there are so many advantages of technology and also disadvantages. So it happens to be we have to think about it. If you ask me what is more risky, like this one, India with a more population, with a permanent this thing, you see, the most deaths in Bombay are reported by the situation of the people falling from the train. We at a glance, who is more risky? Is hospital is more risky, or traveling like this one and all this? So it is up to you to think about it. We are really, if you ask me very sincerely, after we just live by chance. That's what I tell as a microbiologist. Sometimes, see, the COVID, if you take, it has caused a great occurrence. One gives one opinion, another gives, and finally, after 1 year, it has fooled everyone. And now they say that the consequences of this black fungus is a fallout of drugs we are using. Components of control. Now, routine practical essential controls such as the aseptic. This is the most dangerous things which the patients will get infected. Also, it depends upon entirely on the nurse who is taking care of it and all these things. Suppose if she is very careless, either you sterilizing, so many methods are coming. But one thing is there. See, you think about a hammer is there, arthroplasty surgeon is doing, and all. It is really difficult to put where and how to sterilize. And there are also, we have to go with the literature by the. So now always you should insist when you buy an equipment, have a thorough idea before buying how to sterilize that one. Suppose if you take a gas plasma, it is very expensive because every control takes about 1,000 rupees to do it. But it is worth it when you reduce the infection. Suppose you take this one, suppose a surgeon is prepared for an orthopedic surgeon, so many instructions. And please also remember that most cause of the loss of limbs and all, amputation and all, it is also not because of the situation of the patient, but also the happenings in the hospital. Operative approach, infection control, planning and developing IPC program, implementing the IPC, evaluating the impact. So you have taken some method. Suppose you take that I wash, all the people have washed with the common soap, like a routine soap, or just a simple soap, and somebody this thing. Suppose you two watts are using and all, you can also find out what are the incidents and all, depending upon, because research is not that in India we cannot do a complicated research. We have to follow a good documentation. See, this person is showing a file and a letter. I put a lot of pictures in approximately what are all you do. It has to be documented. Only this documentation can only this one. Suppose once you document, you are very careful what to do. So surveillance of the hospital. See, I just want to tell you, surveillance, if you take the hospital quality of the water in the hospital supplied to the patient, you only imagine about it. Most of the hospitals are contaminated with E. coli. But common man drinks with this thing. Now the people are habituated to a bottled water and all. There is this thing. I mean, we have to do a good documentation of what the patients, what are all the things supplied to the patients. Must have a checkup that how safe they are, this thing. So infection priority. So somebody said a great word, education, education. I just want to tell you today, I'm very happy talking in front of so many people. In 1998, there was a hospital, a teaching hospital where we are going. There was a lot of awareness on the needle stick injuries. So I made a documentation that most people who are getting needle stick injury are the ward boys, not the very less of, because surgeons are few and the residents are this thing. See, at least 4 or 5 ward boys, because they are putting in a gunny bag like that and taking the needles, no recapping and all these things. So the first class I took in my own language in Telugu to the ward boys. Everybody laughed with me. You are an MD, you are talking to the ward boys. Don't you think it is below your status? But I am very happy to say today, I just been successful in giving so many programs because I am associated with the things. And also one incident I will share. When I was working in a developing country, there is a British hospital. When I was in a hurry, I went late to the operation theater and I did not wash my hands properly and cloud. Then the British sister told me, Dr. Rao, please, I can't allow you to this operation theater. And I always thank her that she told me that I have not washed. I accepted, I not argued that she is a nurse or this thing. This is one of the things which I am able to make so many impressions to the people. Unless you do mistakes, you cannot learn it. See, what are all the things happen? This is what happens to the patient. See, you see this person has lost his limb just because of some safety this one. And all. Particularly you take it to me, and our house surgeons also needs a great training and all. A person involved in a road traffic accident, not entirely he dies, but by the time he's seen by a specialist is this thing. The wound cleaning is the most important biosafety or biosecurity to a patient. If you don't wash with a good saline and you suture the wounds or you just do a dressing, that is the cause of the gangrene and all these things. Anyhow, less today we have got a lot of antibiotics. Then is working safely is important for your own protection. And also you see the sister is giving an injection. You find one common bad practice about the nurses. They clean when you go for a blood sugar and all these things testing. They will just clean with the antiseptic and they spend the good amount of money. After that one, that person will just touch the vein with an open hand. That means the purpose of cleaning that area is lost, and you are going to have. I will be just short. I will go. This one is around. Doctors, nurses, and other some health professionals suffer from the home syndrome. They believe they're always super clean and sterile. It's not that a senior most surgeon who has done this is called as the Western countries, they called homo syndrome. That means this person has developed a lot of arrogance and he thinks he's a superhuman being. His success, there are, if you ask me, there are so many cardiothoracic surgeons and they went out of their practice because they were not, their cases were getting infected. Mitral stenosis, a simple operation for a cardiothoracic surgeon, but carelessness. Suppose if you are failing in doing a mitral stenosis, mitral valvotomy, or appendicitis, certainly anybody will find something wrong in the hospital. You see that 20% of the surgeons, particularly super specialists, also go out of practice because of the patients get infected with a higher percentage. Next is education, training, development. We'll go to this one. Healthcare workers are among those highest risk of occupation. And this thing, and now you just see now there is a lot of things. Previously, we are worried about HIV, hepatitis B, and hepatitis C, and even the doctors are doing a HIV screening at midnight, 12 o'clock with a rapid test, and they are not touching for a surgery and all these things. The days are gone now. See now that it's alarming that COVID has killed so many very, very great seniors, even at AIMS, that the chiefs have died and all. That means there is we cannot say how they died, why they died, and all these things still a mystery. But the people with associated conditions died. But at least some chance of luck. Some people have survived that we are not going to see. The most important is a needle stick injury. This is one of these things. Actually, we have to maintain, every hospital should maintain. This comes under the Biosecurity Act in the country, but not strong. Suppose somebody got a needle stick injury, if he is drawing a blood from a HIV patient, he should get the antiretroviral drugs within 2 hours. Otherwise, there's no much effectiveness and all. Because once, actually, in good hospitals, they kept in charge of some casualty medical officer, all the needle stick to be this thing. Particularly, they know the HIV, and they also at the same time investigate the person who has been donated and all. I have seen a lot of even doing breast FNAC. There are some people with the HIV got this thing, and considered it as a serious health. Please remember, if you ask me, hepatitis B, now we are vaccinated. Please do also remember, 10% of the people who are vaccinated with the hepatitis B still do not develop any resistance. It does not, that they have to still follow the universal precautions. How you protect when you are dealing with the biohazard material, special precautions, and this has already been this one. Training of the healthcare professionals. Providing statutory and mandatory training is the key investment. I have a good suggestion. There are many good number of doctors are there. All this microbiology curriculum and also the medicine curriculum, they must include a special topic of training for the biosecurity and the biosafety, because COVID is not the last infection we have to have. We'll have many more. Who knows? We may find some medicine. Now you got the alpha, delta, beta, all virus and all. They have mutation. But to prepare the future, I think I'm very thankful to the people who have called me to hear that. I also make a draft to the Medical Council of India with all your encouragement that a biosecurity training must be everywhere, and there should be people should be able to take out the emergency services very fast. As the thing, Doctors Without Borders have got a lot of syllabus like this one that we have to adapt. Mandatory training, determining essential, and all these things for the purpose of this article. And also somebody, I just want to mention, I just as a medical professional, recently there was a suggestion, if you are going to give the vaccine through the subcutaneously, only 0.1 ml is sufficient. But please remember, this is a difficult part to give a subcutaneously. There was a study in, I think, Maharashtra. The tuberculin test failed because the people are not giving subcutaneously. They are going little deeper and there is no reaction. And every patient tuberculosis is coming a negative. This one, see, it is not that tuberculin is totally good. Improper injection into the area. If you give only subcutaneously, it will happen. Suppose you think about this vaccine, I just wanted to write because I'm not actively concerned, but this will create a catastrophe in this country. There were some rabies vaccine, they are given subcutaneously, very little dose. It can be possible for the highly advanced countries, but in India, to train the people is very difficult. Role of this one, microbiology, all this is all microbiology, rapid testing, so many things about. I don't want to go into this. Infection, current issues. shift towards focusing to the ICUs, devices, antimicrobial. These are all the important things. Now, ICU is the greatest place where the people live and die. There is no doubt about it. Then the devices, the circulating time is very less. If you have got equipment for 10 patients, if there you are dealing with 100 patients, then what happens is that the devices, if you take a mask or anything, and the antimicrobial resistance, and these are also now to be included. Suppose unless the government of India includes the antimicrobial viscues into the biosecurity, we cannot bring any change because everybody is going as this one. There should be reason to prescribe. There should be reason to not to prescribe. Otherwise, we will not have any antibiotics. Suppose you could take, and also another issue will come soon. Many insurance companies may not pay for all what you have been used. They say we can't, the patient died, the hospital costs are 2 lakhs and the antibiotics he has used 4 lakhs. That means they will say that you are given an experimental this one. I want a reimbursement. This is already starting. So next is what you say is there very much. See how you pain or anything and all critical care of the things and all. Suppose whatever it is, little the main purpose of conducting routine surveillance is very important. We should be honest. There was an antibiotic policy that should include biosecurity also, but nobody is allowed it tomorrow. I'm going to tell it because the pharmacy industry runs with the sale of the antibiotics. Otherwise, they don't get any much profit on the B complex or common drugs. But they are routinely antibiotics have become a choice of everyone. You have to have a good documentation and to complete some draft and all, but it should have some ethics also. Tools, applications, all these things, unless you have some good ethics in making this biosecurity, it will more for the more corruption. It will lead to the corruption more. If suppose if India, if you want to put a draft from US to India, the people who are handling that rules will become very, very rich and the people will die the same way. And this is my frank opinion, is out of the things. So hand hygiene is the great killer, the whole biosecurity. It is becoming, you just open your eyes, everybody is coming on the highways and green areas, throwing everything. And the future biosecurity requires cooperation of technical policymakers, security engineers, and law enforcement. See, this is a very important. Suppose you take biogas, and this, what is the most important is there. You see, Indian regulation is no. We got so many acts and that, but what biosecurity challenge to, and next is the most important is there. There is a lot of controversy about this voice. What is a neo-bioterrorism after this thing, emerging this thing. This also may be tomorrow, a day may come, the poor countries may adapt for the bioterrorism when they can't invest in the army, air force, and all these things. This is a great threat which the country faces. What will happen? Nuclear, there is a limitations, but individually you can use bioterrorism into a localized aspect and all these things. So because if you are a qualified microbiologist, you have a lot of armamented in your hands itself. That's why I tell you that when I was working in abroad, one British person was telling that at the end of the work, the key of the department will be taken by the head of the microbiology department, so that they will not pilfer anything and do this one. This particularly the British people part is very, very sincerely. And some uncertainties about the policy implementation remain for the future in order to carefully plan out preventive policies. So COVID pandemic has thrown, another 3 slides only, please, I am finishing. The COVID pandemic has thrown open multiple issues, and it is now really changed the medicine. How good we have taken, how bad we have taken will reflect the future of the medicine. National biosafety and bio-waste activities are governed by legislation through the state health ministries in India, that is the pollution control under the integrated disease surveillance program. I don't know, you all people who are in the active service can this thing. You'll see this one, how much a pollution board is working and how their water Are they good, the real documents from the hospital? Are they just telling there are no infected patients, there is nobody infected? Nobody will accept. Is it not in a real sense and all? Because a lot of patients may say that I died because of the carelessness of the hospital and MSU. It's a very common. Biosecurity has sadly remained a step brother of biosafety. It's a very, very good thing. One of my senior teacher told me, biosecurity remained a step brother of the biosafety. His teacher is about 75 years. So when I called him to say that I am having a talk, please tell that everybody that this is a step brother. And COVID, the crisis should serve as a reminder of the importance of doctrine of universal biodeterrence. India, for its part, should strengthen the biosecurity system while mobilizing international cooperation and strengthen this one. Now you see a lot of hurdles for the people who are visiting China to investigate the Wuhan virus and all these things. These are all this one resources are used from this one. So it is, if you ask me, suppose you go to hospital and all these things, I ask that medical superintendent, sir, what is the status of infection? He will bring up and call you please learn from her that infection control nurse. It is not the infection control nurse, but it is all the entire team. Unless all are this one, then no place is safe. So my last, I thank everyone for the Omnicuries and all the professionals involved in healthcare for giving a time and listening to the things. So this finishes the program.
Doctor, we have few questions in the chat box. So, Doctor, the first question is from Dr. Shali Lal S. from Karnataka. So, the question is how to reduce ESBL resistance in hospital settings.
See, ESBLs have become a great menace. And I'm very thankful. This is a very important question. If you are conducting a meeting on this and all, ESBL is going to be this thing. This has really, I mean, multiple fold it has become after the misuse of the cephalosporins. For everything you go there, they are writing the cephalosporins. This has increased. Unless, see, ultimately, if you go to a very, very senior professor, you just wash your hands, everything will be reduced. Suppose if you go to a postgraduate thing, he will tell 100 things about this one because he's appearing for examination. Once he appears for the examination, he will be the part of the people who are not caring at all. So what it means is there must be, the seniors must go to the laboratory. I am talking very frankly, this only ESBL is a very, very difficult question that doctor who has this, please kindly see the articles of the Livermore is the world's highest authority on the ESBL. So he has written, he has done a life dedication on the ESBL. He is from UK. He was awarded best on the ESBLs. ESBLs is there. The first is a microbiologist should go to the laboratory, would have infrastructure, whether it is how the specimen process, how they have separated the mixture, how they are putting to the automation. Now everything is given to the technicians and very seniors. They have to involve, then only this can be reduced. We have to process the sample. I want to tell you a simple example. ESBL, the doctor's, madam's question is very nice. You send a stool sample to a private laboratory, or without any much this one. They will send E. coli isolated and the following antibiotics are sensitive. E. coli is a commensal in this one. To identify the pathogenic E. coli, it nearly one pathogenic E. coli needs about 1,000 rupees to identify whether it is pathogenic or not pathogenic, invasive or not. Things. I did my thesis itself on this ESBL related programs at NICD Calcutta, where to process sample, it costs very much to do the processing in a very systematic way. But anyhow, this is one of the reasons the unguided private laboratories are causing the most important forum of this thing about this ESBL. See, whatever the bacteria they are telling, they are writing and they are doing the testing. This is a great tragedy and it needs the qualified people, whether it is MSc, PhD or MD, you should be able to say it is pathogenic, it is not pathogenic. I want to clarify, human being has got 14 times, say 10 times more Human being, see, bacteria are 10 times more than all the human cells. Suppose our human cells are 10 to the power of 13, and we are occupied by the 10 to 14 bacteria in our own body. So it needs definitely the seniors to go there. It is there and all. And you have to, this is misuse in a last one simple word. It is a man-made ESBL, and pharmaceutical industry is highly contributing to this ESBL tragedy in this country.
Doctor, the next question is from Dr. Kosto from West Bengal. How to mitigate risk of biothreat agents in low resource settings?
See, low resource setting is very difficult because the medicine is so much advancing without any resources. And only thing is there a good dedication to the cleanliness and the decontamination of the equipment, except that they cannot really do it in a poor environment because they don't have any supplies of the disposables many times, and they don't have the proper linen to do and all these things. This is a very important thing. Also, I always tell one thing is there, just I'm not going out into the political or anything. See, resource setting, I definitely, the doctor must be struggling a lot in this one. Suppose you take to a PHC, there is no equipment with the doctor many times except with the stethoscope there and all these things. There is no difference between a quack and a qualified person. This is what is the real tragedy in this one. Suppose, see, I am not against the government policies of some Ayush and all these things. We are in the low settings and all with the advancements. It is very difficult to run the modern medicine because modern medicine is all equipment related profession and dedication by the few people that is there and all. Ultimately, they cannot do anything there in this one unless you improve the infrastructure and also the quality of the training to the people working in this one. Infection is not just that an antibiotic is not a solution at all. It is infection never come into anyone unless there is a breach of the protocols, which are mainly this one. That is important. Only thing is there and all, he has to ask for more equipment and also the ability. See, in villages and PHCs, no bacteria are cultured, no facilities for microbiology or a clinical pathology. They're all on the best experience, they are doing it. Now it has become a curse on the increase of the antibiotics.
Doctor, the next question is from Dr. Manyam from Kerala.
Yes.
The question is how to collect blood from an HIV patient.
Yeah, very good question. HIV patient. You see, there is no difference between collecting a blood from the HIV patient or a normal patient. You wear a glove. You suppose if you are worried, wear a double glove. And also, once you draw the blood, don't keep the needle and do not keep the needle outside or anything. It can cause this one. See, the needle threading and all has been developed because of this HIV only. Suppose if you are keeping the needle open, you can get punctured your own hand. You take the blood and also with a caution and a good light, you inject into the blood into a blood culture bottle. It does not mean anything. See, universal precautions made very simple thing. Wherever you see blood, you think about HIV or hepatitis B. And you take the blood and without any cross touching anything, you just inject into the bottle, and you should be very careful in doing it. See, when you take the blood, nothing will happen. What the most you are going to prick one or more when you fail and all these things. For a person who is taking, there is no risk at all if you are careful.
Thank you, Dr. T.V. Rao, for your valuable insights on this interesting topic. So this brings us to the end of this webinar.
Thank you very much.
Thank you, Doctor.